Zika. We've all heard of it by now. The virus swept across Latin America and the Caribbean last year, causing a surge in cases of babies with birth defects. The effects of the Zika epidemic will be long-term, especially in the poorest communities of the region. Beyond the cost of diagnosing and treating patients, the impact on economies in the region is staggering. Parents are forced to quit their jobs to take care of their babies with microcephaly, and tourists are scared away. Our latest research shows that the cost of Zika could reach up to $18 billion over the next 3 years for the region. That's about 3 times the cost of Ebola, or a bit more than the GDP of Iceland. To put it in perspective, an average of $1 billion will be spent for every 5% increase in infection rates. Brazil is expected to bear an enormous burden because of the sheer size of the country's epidemic. But the Caribbean will be the hardest hit, mainly due to the projected drops in tourism. The region's poorest countries will also suffer greatly. The most vulnerable people in each country are being disproportionately affected by Zika. Our research found gaps in detection, prevention, and coordination services, especially for disadvantaged groups, such as poor women. The World Health Organization announced that Zika will likely remain endemic. So what needs to be done? We need budgets that invest in adequate health service provision and accommodate extra financial resources for the potential impact on trade, tourism, foreign direct investment, and social welfare. We need to scale up combined efforts to control the mosquito that spreads Zika, dengue, chikungunya, and yellow fever. These need to be holistic and streamlined. We need planning for long-term health and social services to start now to support the growing numbers of low-income families with babies affected by microcephaly or other conditions. We need to promote public policies that promote gender equality and are targeted to affected communities. We need governments to develop and lead multi-sectoral plans to control mosquito-borne diseases that goes beyond the health sector to consider the economic, social, and environmental impact of the virus. Zika is a development issue. We need to engage communities. Educating and changing people's behavior is key to controlling its spread. Without that, fumigation campaigns will have limited effect. Together, we need to keep our children and families safe and act responsibly with the finite sources we have.